Okay, so in this video, we're going to be going over the straight leg raise test, the slump test, and the crossed straight leg raise test. So essentially what our case study was is that there's this 30-year-old female who bent over to lift something up. She felt acute pain in her back. It was about 10 or so days ago. And she had shooting pain down her left buttock, kind of right above the knee. And so that's kind of basically like the patient that she'll be representing today, and I'll be doing those tests on. So the first one I'll be doing is the straight leg or the slump test. So essentially I'll just bring my patient into flexion like this and have her instruct her to lift the left leg up, and then I'll tension the ankle, kind of like the dorsiflexion, just pull the toes up, and then just bring her into that full flexion and extension that leg. And then if there's any reproducible symptoms like her accident, she let me know. What we're doing is just tensioning that nerve kind of on that back of the leg, like the sciatic nerve or the tibial nerve. So it's just, just the lengthening of the nerve kind of could be the cause of your symptoms. And so now we could compare that on the other side too, just to make sure. Now we're just gonna move into that straight leg raise test. So if you could lay on your back. And we'll work with that left leg again. So all we're doing here is kind of like that same thing, just bring this all the way up as far as we can. And then kind of putting some more tension on there.
Oh yeah, I feel that.
Yeah, so a lot of times the patient will just kind of feel like a hamstring stretch. But generally, if they start feeling symptoms like before the 70-degree mark is when you kind of know it might be more of that nerve issue. If it's generally past the 70-degree mark, a lot of times that's more of like an SI issue. And so the crossed SLR is now essentially it's exact same. So we would do the same thing we just did with that straight leg raise. And then let's say she had symptoms on this left side. Then I'd come around and I would do it on the right side, and if those symptoms were reproduced, that is ruling in a possible disc herniation. So that's just a little disc between her spine, kind of gets pushed out a little bit. It could be causing some inflammation and things like that to those nerves. And yeah, that's it.